cell phones, to please silence them, shut them off, or put them on vibrate. And also, if you have the new fandangle glasses that you can see up here in the corner and it records, please remove them and put them away. I do not want any unauthorized recordings today. All right, since we got that out of the way, Miranda, would you please do roll call?
Miller. Here. Kramer.
Here.
Engel. Hendricks.
Here.
McGuire.
Here.
Barris. Braithwaite.
Here.
Chicker. Yep. 5 for a quorum, ma'am.
Thank you. We need verification of open meeting law compliance, please.
Has been properly noticed, ma'am.
Thank you. We need a motion to approve our 11-point agenda. Do I have a motion for that?
Also move.
Thank you. Do I need a second? Any discussion, changes, or additions they want for this agenda? If not, all in favor say aye.
Aye.
All opposed, same sign. Approval of minutes from October 2nd meeting. Is there anyone who wants to make a addition, deletion, correction? Hearing none, we'll approve the minutes as written. All right, anyone here with public comment this morning? Right, moving right along. Okay, down to reports. HHS Director, Administrative Report, please.
Sure. Okay, so our updates today is really kind of looking back on October and all the fun activities. The ADRC was excited to announce they got the 5310 operating grant was approved and have submitted the 8521. We're waiting to hear back on that. They had huge success with the Rise and Dine that they did. And so they're hoping to offer, well, as you can see by the update, they're offering that again on a couple of different dates. Behavioral health, with Brandy Christensen leaving, I did not track how many came in for this program or that program, my apologies. But I do know that the staff have been working really hard, doing what they do, even without a manager. I had hoped to make an announcement today for manager, but I only have a verbal acceptance from someone and I don't have anything official to report. So hopefully next month that person can attend next month and I'll introduce them. Yeah, so, but I'm excited for that part anyway. In child and youth services, only 4 children are currently placed out of home, which is great. It's been a long time since it's been that few. And then we did hire a case manager, Aaliyah Ruland. So we do have 1 open social worker position right now. Economic support, they shared their statistics for the month. They too have hired 2 new economic support workers who started on October 27th. So they'll start their training here shortly. They're busy right now answering calls about the federal shutdown and the fact that they're not getting their food share.
Sure.
Right now, the month of November. I was on a call the other day that they're hoping to maybe they'll be able to distribute half of an allotment soon, but obviously it's, still all up in the air. So definitely, if you're talking to people, encourage people or ourselves, donate to food pantries. If you can't do food, do money so they can buy food. And that's kind of what we're doing, is referring people to other resources. Public health, I think the biggest news there is it's flu shot clinic season. So they've been going around and giving flu shots. Or they've been going around and doing flu shots in the schools. So yeah. And the only other update I have is that, and I didn't have it on Instagram, but 2026 budget was approved, so that's exciting. So that's, so yeah, so now we'll wait for that to go into effect and then we'll start 2026 fresh.
Now, are you giving out the COVID vaccines as well?
Not right now, no. I do see a note here that it just says COVID shots will likely be offered again, but I haven't heard when they're coming in, or if they're in. Brandy's online. Brandy, do you know COVID vaccines?
Hi, can you hear me?
Hmm?
This is Brandy in public health. Yes, we're because of the changes in the formulation, we're getting updated orders to get our 2025-2026 COVID vaccines in place. So that should be coming. We do not offer those for billing. So people that need that need to go to like their pharmacies or hospitals if they have insurance. But we will be able to have doses for the VFA and VFC, so uninsured, underinsured populations.
And Brandy, do you know anything about the RSV vaccine?
I mean, that would be the same. So RSV vaccine, speak to your doctor if you're interested in that. Again, we would not carry that for people that would need it as far as billing reasons, but we don't get a lot of requests for that. We can order it in. We just don't keep it on hand just to prevent wastage.
Sure. Thank you. Anything else for administrative report?
No, that's it. Let's have other questions.
There has been a request, Chairperson, that we move to number 8 because they have court at 10 o'clock.
That's very important, yes. All right, so we're going to change the agenda a little bit. Sorry, I'm going to interrupt.
No. that's
Okay.
But that's why all of these individuals are here.
Yeah.
That's why you're saying, what?
Well, we're gonna have discussion and possible action. Approval of the opioid settlement grant application. So let's go to that, please. And who wants to take the lead on that?
Well, I can just start to let you know that, in your packet, you should see, we did receive 2 applications. One is for treatment court incentive funding. At one point in time, treatment court could incorporate that into their budget. They cannot do that anymore, so, they've been purchasing incentives for the program through the opioid settlement funds. So this is just asking them to renew it for 2026. And then they're also asking, the tag team is asking for funding to attend the All Rise National Conference. So those are in your packets, and they broke those all out, broke out their budgets, and then they are here to speak to them. So actually, Savannah Huber, looks like they pushed you to the front.
All right, so I'm the grant treatment court coordinator. And the first grant, I guess, request we have is for the incentive funding. We were awarded it for this 2025 year. We were awarded $5,000 last year, which so far this year, we've spent a little over $3,000. Treatment court is an incentive-based program. Participants in our program are rewarded for doing well within the program, making good decisions, showing up, things like that. They are also sanctioned when they do not meet program requirements. A big use of these funds goes towards, as mentioned, incentives, supplies, graduation purchases for the 2026 year. When our participants graduate from the program, we like to have a little celebration for them to kind of boast on their accomplishments, graduating, doing the hard work, and a great deal of the participants do enjoy having their small accomplishments be celebrated and their big ones as well, such as graduation. Having this kind of highlights the program's commitment to growth, building confidence, and reinforcing positive behaviors that essentially we hope to support long-term recovery. This funding also helps to supply some of our participants with transportation to and from their appointments, some individuals to and from court. It helps them maintain treatment and get to and from where it is that they need to go in order to meet what it is that we're asking them to do. The grant itself, we do get awarded, I believe, $130,000 from the state. And then we have tax levy funds of $43,334. But as Stephanie mentioned, the grant itself no longer allows us to purchase these incentives that our participants enjoy. they took away from it. And we're no longer able to use them. So the opiate funds would greatly benefit treatment court as well as the participants in the program.
And you've used how much already this year?
A little over 3,000.
This is November. What, anything else?
Not for that one.
Not for that one. Well, we have this in front of us, a 5,000 grant amount request, which you received last year as well.
Correct.
So I need a motion. Elaine? And I need a second to approve. Mary? Now we can, have any questions or discussion from the committee or other people in the audience, or anyone online. No questions. Okay. Dan, you look like you have a question.
Well, I was wondering, who signs this? Okay, I don't, maybe that scrolls up, is there a signature in the bottom of this? There has to be a signature by someone, right?
It should have been Savannah was the applicant.
Okay,
Yeah, I see the signatures missing. You can have your signature right now. I just caught that as I was scrolling through, I'm like, oh, wait. Here. Sign together. There we go.
Anyone else?
thank you.
Yeah,
You're welcome. Thank you. Okay, if there's no more questions or comments, all those in favor, please say aye.
All right.
All those opposed, same sign, please. Great, that one's done. What's the next one on the agenda here?
So the next thing is Richland County Treatment Court is requesting for participants, or excuse me, team members to attend the All Rise National Conference in 2026. 2026, the conference is going to Nashville, Tennessee. Should be noted that treatment court started in 2017 through this treatment alternative and diversion grant. Through the course of the program, we've been able to provide services successfully for 45 participants, as well as working with other residents within the county to kind of connect them with treatment resources and services. The treatment court mission itself is to promote present and future community safety by reducing recidivism of criminal offenders who are substance dependent by using evidence-based practices. The guiding principle of treatment courts is the belief that every person has value and the power to change their lives and become sober, responsible citizens, thereby improve their lives, the lives of families, and our community as a whole. So with the need for this is, with us being a rural community, we have limited resources as well as providers. By attending the conference, we hope to gain some knowledge from other rural communities on best practices, how to navigate having limited resources, and how the community can better support the individuals that we serve. This conference has content for treatment courts of every region, every size, all over the U.S. The ultimate goal is to obtain the highest level of education and training that's offered by the National Association of Drug Treatment Court Professionals. The hope is for at least 8 team members to attend the All Rise Conference and participate in a minimum of 3 workshops to enhance our knowledge and skills. By June of 2027, we hope to implement 2 new practices or program improvements to ensure that we are in continued alignment with the national standards, which would ultimately strengthen the overall program effectiveness. I did include a project timeline on the application, identifying members to attend, developing a conference agenda, travel budget, registration, attending the conference, going to some outbreak sessions, collecting resource materials from the exhibits, vendors, presenters, things like that, document our key takeaways, obtain materials to implement new or newly learned practices such as participant incentives and supervision strategies, and then begin planning for continued professional development. Long-term, we hope to maintain integration of the evidence-based practices gained through this conference, to track improvements made to the program as a whole, participant outcomes, and then show the value and need for ongoing professional development. It is an annual conference, however, this would be Richland County's first time attending it. It should be noted, all surrounding counties have gone to this conference. Grant, Vernon, Crawford, they've all attended within the last couple of years. So we're only requesting funds to attend the 1 year. By investing in the training and collaboration opportunities, it strengthens the program's capacity to deliver some services to our participants and maintain long-term program success, which is ultimately to reduce recidivism within the community, change the lives of the people that we're serving, and have them be sober, responsible citizens. I did include a budget, for what's requested, and a breakdown of what that looks like as well. It's travel, lodging, meals, registration, things like that. That's all.
Need a motion to approve?
So moved.
Second? Elaine? Now we can ask questions, discuss. Does anyone know what the total amount of the,
The
uh,
total estimated on the sheet, it kind of varies if we rent a vehicle or drive ourselves, but it should be around 17,000.
and what is the amount of the actual?
16,000.
Right. What I'm asking though is the opioid settlement that's coming to the county, how much money is?
I pulled up Fund 99 and it looks like we have at least 167,000 in that fund right now.
But I believe there's also some that's an investment, so there's.
Yeah, that includes the investments.
So we have
Yeah,
plenty.
Oh, that does.
that's including the investments.
Oh, okay.
That's at a minimum. I'm trying to decipher this report. At a minimum, 167,000 is in there right now.
And there could be more
And there's
coming.
more coming, yes. I think at the end of it all, 20 years from now, there'll be.
430-some thousand.
Yeah. So if you're asking, is there enough in there to cover this? Yes.
Okay,
Sure.
that's what I wanted to know. Anybody, Mary?
Yeah, how did you come to 8 people going? Is it chopped up when you get there where everyone is hearing the same thing?
I asked the team members who would be interested in attending. The team total, I believe, is 10 team members, and only 8 were able to fully commit to being able to go.
I can speak to your second part of your question. Yes, there are like 8,000 attendees at these events. I went for Iowa County a couple of years ago. And there are just a multiplicity of seminars addressing various aspects of treatment courts across the nation. And there's a whole sort of section for rural treatment courts. So, but no, we don't all go en masse. There are some that are, I'm a defense attorney, so there'll be ones that'll say, drug treatment courts for defense attorneys, what you need to know. And then for the judge, there's different seminars for the different participants.
This came up last year,
It did, yes.
didn't it?
It did.
Right, and I thought like last year was in Florida, right?
Correct.
Then, because I know it was going to be, what is the date of it? Now,
July,
okay, next summer.
July 2026.
So I know we talked about being closer this year.
Do you think in the future that there would ever be like virtual for these counties that don't have the funding to send everyone?
I can't say for sure. I know during like COVID, they
Mhm.
had the virtual options, but every year prior to that, it's always been an in-person attendance.
Francis, we gotta leave that door
Oh,
open
okay.
because this is an open meeting.
Oh, okay, because it was just some noise in the
I know.
hallway. Okay, all right.
Sorry about that, but yeah, we gotta leave the door open. I'm sorry, hon. Go ahead.
Sorry, during COVID, the COVID shutdowns, they had the virtual meetings, conferences, things like that, but I know every conference prior to that has always been in person, just because of the way that you get versus attending things in person versus online.
Well, it's the same thing if you attend like a college course online versus being in the classroom and conferences for other things. But I was just wondering down the road if that's something that they could possibly look at. Because not everybody can attend,
Right.
and it would be wonderful if they could do that for those people who are unable to attend for one reason or another. But anybody else have any questions?
So another question
Sure.
for Trish and Stephanie. So this is paid for under this program. The county doesn't have to put anything into this?
Correct.
When the mayor did.
Do I? To do some of this.
And this has to go in front of the county board for approval. So all those in favor of, pushing this to the county board for approval, say aye.
Aye.
All opposed? County board, here it comes.
Okay, let's go.
Thank you.
Helps a lot of people. I appreciate it.
You're welcome. All right, Stephanie, we're back to you.
Back to me.
Yes.
Actually, you're back to me.
Expenditure.
Yeah. Thank you all. Thank you.
You're welcome. Oh, just in case you want to attend the county board meeting, we did change our hours from 7 PM to 6 PM. So just keep that in mind for our next one in a couple of weeks.
You know the date of that?
Ah,
18, I think. 18.
yes, I believe it is.
I believe it's 18.
Yeah, 18.
Thank you, Bree.
You're welcome.
How you doing, officer?
Good.
Oh, my God.
Tips.
All right,
Are we ready?
we are ready.
Okay, so starting with the expenditure reports, there was really nothing out of the ordinary or unusual through those. Our overall departmental spending is at 73%, which tracks closely with our target of 75% for this point of the year. Most across our other divisions with administrative services, ERC, and building and utilization, our spending is falling in the 65 to 70% range, which is showing good fiscal control heading into the next quarter. Does anybody have any questions about our expenditures for last month?
Like you said, there was nothing really big that I could see. Of
Correct.
course, health insurance is always big.
Correct.
So-
I think the only really thing that was out of the ordinary per se is that we had public health vaccines, but 'tis the season for that. So, I mean, that's not really unusual either, just kind of a change for where we're at.
Are you having a lot of people taking advantage of the vaccines over here?
I don't think, so this year, I know that they're going to schools per se and maybe getting a little bit more traction there, but, as of in person, no, not.
Yeah, Brandy would know for sure, Brandy Anderson.
Brandy's here.
Brandy's online.
Brandy, can you speak to that at all?
Hi, can you hear me? This is Brandy.
Yes, we can hear you.
Yeah, so I guess we used all of our non-billable allotted doses that came from the state. We used up every single dose that was given to us, 190 full doses for the schools. So we were happy about that. Um, that number was cut back from previous years. That was not in our control. We had requested actually more doses, but we were pleased to give what we were able to give, and actually kind of surprised. We are not getting a lot of inquiries about flu shots for billing. I think that what we're seeing is people are getting them at their doctor's offices and pharmacies sooner. But we do have some limited stock available.
All right.
All right,
Yep.
that was that.
Anybody else have anything they want to ask?
How much did the insurance go up this year
Health insurance,
or next year?
about 11%.
11%.
Should we segue into C then? Hearing no questions?
Mhm.
Okay. So for the budget summary, looking overall, the department's year-to-date balances remain very stable. The adult placement funds are trending normally. We're sitting at about 63% utilization, so no major deviations to report there. Overall, the department remains on track financially, and we're just continuing to monitor expenditures and reimbursements closely as we approach the year end. Any questions?
Okay. Thank you.
Thank you.
All right, moving on to D. Pine Valley Community Village Administrative.
Good morning, everyone. All right. So we actually just had our biannual for our assisted living and got absolutely no citations. They did a fantastic job. We are transitioning our food procurement to what used to be called Reinhardt. And that's looking about a $20,000 annual savings, if not more. They did our top 100 items, not including everything that we tend to order. So looking to save money there. Our water is still good. Don't have any issues with our water still. We will be rolling out ITSE, which is the International Dysphagia Diet, something. So we will be rolling that out as of January because that is now the only recognized dysphagia management. So hopefully getting that rolled out January 1st, it's our hard date. January 1st is our hard date for like peer food performance. And then we are posting for RA to CNA. We are working with Siesta, which is a company that we hire staff on and then they pay for the people to go to school. So it's not even something that comes out of our budget anymore. We are setting up our giving tree for our residents. So if anybody would like to come down, I will talk to Mallory about the actual hard date, but just kind of wish lists of some of our residents. So if anybody would like to come to that, and then I will be heading to a focus conference for my required CEUs to kind of have a little bit, with new regulations, they have a refinement for rolling out the ITSE requirements, you know, investigative, those sorts of things. So I will be out for, that'll be in Green Bay. And that starts on the 19th. So
This month.
of this month, correct. So I will be attending there. It's the 19th. It starts bright and early in the morning. So I'll be going up on the 18th. So it is a couple hour drive. And then it goes to the 20th. So
2 days.
yeah, that's what I have. Questions, comments?
Anyone have any questions? Comments? Your giving tree, are you going to advertise that?
Yes, we are gonna post it on Facebook. And I think we'll go through the radio as well, just kind of get that going. We haven't set a specific date in which it's going up, but I know their plan is to put it up this month in hopes that, you know, people can start, if they're starting their Christmas shopping now.
This will be right at,
Yeah.
because it used to be at Ace.
Maybe Ace, but I know we're also putting one up at the building.
Right.
I said, I believe we're putting one up at the building, but yes, I think they do some at Ace still. But we will, that'll all be posted soon, but I want to give everybody an opportunity.
And the sooner the better.
Yes,
So it gives people time to see it.
yeah, at the foundation meeting, we talked about getting it up and going. The sooner the better even before Thanksgiving, I think.
Yes. Yeah.
So,
Anything else, Brittany?
our CBRF is on a COVID outbreak. Yeah, it was only one staff member, so it has not gone any further. Jesse, our DON/infection preventionist, is fantastic, and the second we have issues, she's implementing a bunch of stuff, whether we agree with it or not or like it. And I think it's been a huge help with isolating and getting things under control before they become an issue.
Yes. Anyone have any questions or comments? Anyone online have any questions? Thank you, Brittany. Child Support Agency. Ta-da, we finally got to you.
No, that's okay. All right, so my report is for July through September. I have not got final numbers from the state for October yet, so that's why those are not included in there. September 30th is the close of our agency's federal fiscal year. That's when the cutoff for the state is, and that's how all of our performance measures are calculated, is as of September 30th. While we ended September hitting 3 of our 4 benchmarks, which is great, it's a little disappointing because we've consistently in the past years been able to hit all 4 benchmarks. Paternity establishment, we blew out of the water. We're way above the state average. Court order establishment, we were almost 12% over the benchmark. Our arrears collection, we met that benchmark by a little over 1.5%. Now the arrears collection will start over October 1. It puts us back down to 0 and we have the whole year to hit that 80% benchmark. The collection of current child support, that has been a statewide struggle. The conference I was at, every one of my leadership meetings I've been in, that is kind of the trend, is either people saying they can't afford to pay their child support, they're having a hard time finding a job, they don't want to find a job. There's a lot of our participants that struggle with addiction or consistent repeating incarceration. So the average collection rate for the state was 74.51%, which is even below the state benchmark, and only 30% of the 72 agencies were able to reach that benchmark. Our agency ended the year 14th in arrears collection, which is great. We ended at 81.59% and the state average is 68.14%. From a staff and training perspective, unfortunately, our clerical assistant position is open again. Jackie, who we had filled the position with in July, she had to resign for medical reasons. She didn't want to, but she had to, which is sad because she was a really good employee. So we posted the job. It closed again November 4th. Charlene and I have been going through the resumes and applications and are hoping to start setting up interviews for the end of next week. So hopefully at next quarter when I report, we will have a new employee hired for our office. The annual Child Support Enforcement Conference was held in October. It was in Appleton this year. Attorney Forehand and I attended. It was a wonderful conference. Gained a lot of new knowledge on things. I came back with a notebook full of notes, so I was glad that we were able to attend. Our agency staff just completed our annual required compliance training for the state that we're required to do annually. And then next week, I'm going to start my second year of director training. So any new directors, the state requires you to do 2 years of training. It's usually 1 to 2 virtual meetings a month for 6 months. Our budget reports are as of September 30th. We have 32.69% of our expenditure budget remaining, which is a little above what we should have left. So I hope that means that we're being fiscally prudent. We have not received our third quarter reimbursement yet. Those usually come they're paid the end of the month following the close of the quarter. So I haven't checked with Tammy Newberry, but we should have received it at the end of October. And I'm estimating that that payment should actually put us above our projected revenue for the year. But as of September 30th, we've received 81% of our projected revenue, which did include a small medical support incentive payment of less than $200. I do know that we recently were issued, and it's not on here because we got it in October, we did get another incentive payment of just shy of $12,000. So, our agency had our triannual review in July. That's done by the Bureau of Child Support. They provide a review summary 30 days after the review is done, either showing findings of noncompliance or recommendations. A finding of noncompliance is required to be rectified within 30 days of receiving that report summary. Recommendations we can choose to complete at our agency's discretion. So we had 6 findings of noncompliance. I don't want to make excuses, but I will say that some of these noncompliances were they were ignorance. I had absolutely no idea that this was something that the state required us to do. Unfortunately, as a new director, as any supervisor will tell you, you don't have time to go back and read years and years worth of guidelines to find out what you're missing. So our first finding of noncompliance was my position was actually not categorized correctly with the state for the type of casework that I was doing. We are sampled for our casework. You'll be working, we get what's called a random moment sampling. You get an email that says, today at this time, what were you doing? And you immediately have to log in and say, this is what I was working on. And they then each quarter, they use that information to calculate out, it goes into a formula which is used to calculate our quarterly reimbursement. So that's been corrected. I did work with the state to find out how my position should have been categorized and got that corrected. The second one was our administrative complaint process was not followed correctly. What it came down to was a letter was supposed to be sent to the complainant within 10 days of the fact finding and resolution being done. It was a situation that I actually had to turn over to Windle. He had emailed the person and they said, no, you should have actually sent a letter. So we just did some review in our office to make sure that moving forward that we are following that correctly. The third one was we are to have a agency remote work policy that specifically addresses our IRS compliancy guidelines. Those guidelines are not currently in Richland County's remote work policy, which is what we were following. I did write a policy specific to our agency. It was sent to Administrator Clemens. It was sent to the MIS director who both reviewed it. And I know there's been talk about maybe in the future of just adding that language to Richland County's remote work policy. So we only have one and done. And then I also included an attestation that staff will sign that are approved to work remotely. They'll just sign it every year. to show that we're remaining compliant with that policy. Our fourth finding was that a rehired employee, which would be myself, did not have a successful background check upon rehire. So I had left the agency for a year and then came back. I was still technically within the 5 years of having a background check done. And when I was rehired back, Attorney Forehand was the interim director. She said she didn't know that I had to have a brand new background check done because I was within that 5 years. So as soon as we found it out, I scheduled myself, and the next week I had my background check and it came back fine. I had not committed any crimes within that year. And then I also had discussions with Justin in the HR department, just so that we're all on the same page, that any new hires, even if they're rehires, about getting those background checks done for rehires. The fifth finding was our keypad combination was not changed annually when a staff leaves. So if you come into our agency, there's our primary door to walk into our agency, and then there's a secondary door to actually come into the workplace, which is keypad coded. And again, it was just something that we didn't know we were supposed to do. So I worked with Randy, the maintenance supervisor. We got the keypad code updated, and then we just updated again after Jackie's departure. And then our sixth finding was we have an authorized access list. It was missing points of contact name and level of access. So these would be persons that are authorized to come through that second door into our workplace without having to sign in every time. So for example, Administrator Clements came down to have a meeting with me the other day. She is not on that access list, so I had to verify who she was, have her sign in, and then sign back out on our visitor log. Whereas like if Deputy Clerk Miranda over here is delivering me paper for my office, she is on the access list, but her level of access is only delivering office supplies. So we had to put specifically why they are able to come into our office without having to sign in and out. And that does exclude emergency services. So if there's an emergency in the building, police, fire, EMS, they could just come rolling in and out, and that's fine. So that list has been updated, and then I regularly review it to make sure that any changes are notated on there. And then we also had 5 recommendations. It is at our discretion to do these, but I figure if the Bureau of Child Support is recommending them, we're gonna do them. Why not? Yeah. There was just an error in the language on our customer service plan that was corrected. We updated the agency's complaint policy so that the language more matches the federal policy. Background checks must be completed prior to a new hire's first day. We reviewed that process with HR to ensure that, everybody's following that for our agency. And then I created it's called a no print policy. Again, we follow federal tax guidelines set forth by the IRS. So it is a specific policy directing our employees that they are not allowed to print, fax, or email any federal tax information that our agency has provided directly from the IRS or the Department of Revenue. And then that also includes an attestation that staff will sign on a regular basis when we review that policy. And then if any information must be printed, we have to put it on an IRS tracking and disposal log. And that was just updated to meet new federal language for federal guidelines. So that was a lot. But I just felt it was really important to you guys because this review's only done 3 years, to just kind of let you guys know like what's happening in our agency, that we corrected these findings right away. We decided to take every one of the recommendations and just put them into place. That way down the road, they don't become a finding. So if you guys have any questions, comments.
Okay.
I didn't hear the part earlier in your report about you had a position open again, someone resigned, retired,
Yes.
whatever.
So over the summer, we had posted for a part-time clerical position. And we had hired a staff member, her name is Jackie, and I had actually reported her being hired at the last time I was here. Unfortunately, even though she was working out great, she did have to resign her position and it was due to some medical issues. I did offer her a leave of absence, but she said her physician, it was gonna be way longer. And so she ended up having to resign.
Okay, I have a follow-up too.
Yes.
From a functional, point of view, was this employee a good employee?
Yes.
I don't care about names, but,
Yes. Yes, she was.
okay,
Yeah.
I'm always concerned when quality employees of the county leave us for whatever reasons, and we've had this go through with the police department.
Yes.
We were losing good, patrolmen over to the Sauk County primarily.
Right.
So what was their issues here, other than you said, she had some medical issues?
So.
Did she quit entire, was it a she?
It was a she and it was
She quit
totally
entirely for medical reasons?
correct.
She did.
Correct. Actually, when she came in to resign, she was extremely upset. She said she loved her job. I had absolutely no issues with her at all. But as you know, you can be perfectly healthy one day and the
Yeah.
next day get some devastating news. You know, and of course, it's not my business to pry into that and ask her that.
So she didn't leave for any other reasons
No.
other than medical?
No, and I actually encouraged her, I said, if down the road, if your health allows it, I said, I would encourage you to reach back out to the county. I said, well, we may not have a position open in our office. There may be something else within the county that you would be qualified to do, because she was a very good employee.
Yeah.
So, yes, it was just unfortunate circumstances came up shortly after she was hired, so.
Okay, thank you very much.
Anyone else have any comments or questions? Anyone online? Hearing none. Thank you, Melanie. That was a very nice report.
Thanks.
We have any correspondence? Any future agenda items anyone would like to see for our next meeting? Anyone?
Can I add to the list?
Yes.
Just to double check me, because I have my list, but just in case I don't forget. We'll do our quarterly contract monitoring report. We'll do a quarterly org chart. I will have some contracts that will be over 250,000 for 2026. And then we'll have to update some of our fees. Thank you.
Anyone else? Want to be put on the agenda? Anyone else want to be put on the agenda? I need a motion to adjourn, please.
Also move.
Need a second?
Second.
All those in favor say aye.
Aye.
All those opposed, you may stay.